Dr. Deena Manion, Chief Clinical Officer of Westwind Recovery.
What does the day-to-day look like for you here?
So my day-to-day at Westwind is really supervising all of the staff and making sure that the clients all are getting what they need, and really kind of just walking around the center, introducing myself to clients, meeting people, providing clinical supervision, providing administrative supervision to the staff and the clients. I started working in New York on the streets in Manhattan and the Bronx with homeless, psychiatric, and addicted clients. And it really built my foundation of wanting to work with people who are really struggling at any socioeconomic background. I worked at hospitals, I worked in the school systems, I worked running a treatment center in Malibu for 18 years before I came to Westwind with people who were struggling with substance and mental health disorders. And I have been a contributor on the Dr. Phil show as well as other shows, and I've written a lot about substance and mental health in publications, trying to kind of help people understand how mental health and substance kind of goes hand in hand.
What inspired you to work in addiction and mental health treatment?
I was originally inspired by my husband, who actually was in recovery when I met him, and I had never met anybody that was in recovery before, and I thought it was just fascinating in terms of what happens to people when they turn to drugs and alcohol to self-soothe when they're children or young adults. And I've always loved to work with kids and young adults alike.
What do you find most rewarding about helping clients in recovery?
I think the most rewarding thing about working with clients in both mental health and addiction recovery is when they have that kind of aha moment, when they really realize that they can do this. They can actually change their lives. They can feel better. They can get better, and they can recover and heal in a way that they had never imagined themselves to be able to do before.
What message would you share with someone who's struggling or thinking about getting help?
It's really important to reach out and ask for help if you need it. There is so much help out there. You just have to kind of take that first step, make that first call, pick up the phone and just say, is this for me? And whoever's on the other end of that line, especially at Westwind, is going to help you to know exactly what you need to get better.